Welcome back. We are answering your questions about the coronavirus and the vaccine with Wesley Long Hospital's Chief Medical Officer, Dr. Jeffrey Hatcher. Remember, you can text your questions. The number's at the bottom left of the screen, 336-379-5775. All right, doctor, this person is asking, how long should I wait after getting my second COVID vaccine before I get another vaccine like shingles?
I don't think there's really a standard answer for that. I'd probably say at least 2 weeks.
And why is that, so that people will understand why?
I think the concern would be that you wouldn't want to have sort of too aggressive an immune response after you've already sort of primed your immune system from one vaccine to another.
Okay. Then this question is, does Cone Health plan on starting vaccines for Group 5 earlier than expected?
So I think that we'll start the vaccines as soon as we have them available to do that, and it's approved by the governor. So it's really a matter of supply and approval, government approval, since the government is really sort of regulating how we're able to use these at this point.
And the next question is, have you heard about more people feeling strong symptoms after getting the Johnson & Johnson shot, which of course is the 1 dose versus the 2?
I have not heard that. Certainly there's a lot of sort of talk on the street about the different vaccines, but I have not heard that about the J&J vaccine.
And I know we've often had this question before of should they get one vaccine over another vaccine due to the side effects?
Yeah, that's a great question. You know, I think that there's not really any difference there. If you were asking me about whether I should get the Pfizer vaccine or the Moderna vaccine, I would say they're about the same.
And about the same as the J&J as well?
Yeah.
Okay. So this next question is, what vaccine is Cone Health administering?
We are getting a combination of Pfizer and Moderna supplied by the government.
Okay, so right now Cone has both of the 2-dose vaccines.
Yeah.
All right, so this person is asking, what happens if I contract COVID between my first and my second vaccination doses? Should I still get that second dose?
Yeah, you should absolutely get the second dose. One of the reasons is we think that by getting the vaccine, you'll have a more standard response in terms of your immunity than if you had just gotten a native infection. So it'll be a more even response in terms of how much antibody you make and how much T cell responsiveness you'll have.
All right. And then what about if I want to be extra safe, should I get more than one vaccine? And what will that do to my body?
I wouldn't recommend that, although I don't think it would be detrimental or be particularly helpful.
Neither one. You don't think it like doubles your immunity?
No, I don't think it would double your immunity, and but I don't think it would particularly make you sick from it either.
Okay. This person is asking, will kids be safe under the CDC's guideline of kids in classrooms being allowed to be 3 feet apart versus 6 with a mask? It worries me a bit.
So the data from that, the study that's based on has really sound science, and it looks like that's a reasonable thing to be doing. I think that we know a lot that kids really aren't, the risk of a child getting sick from COVID is very low compared to an adult. Part of the worry is that we'll have kids becoming carriers or getting sick with the virus or bringing the virus home and infecting susceptible adults, which is probably the major concern with having a lot of kids in school and being sort of this melting pot for viruses.
So this next question is, what do you say to people who just say, I'm not planning on getting the vaccine?
I try to non-judgmentally ask them why, and I try to tell them what are the benefits of the vaccine. And then I also tell them my personal experience getting the vaccine, which was that I didn't have any side effects from it. I went out and rode my bike 30 miles after I got my second dose because I felt great. And then also I felt like I was really doing a great thing in terms of protecting my family.
So this person is saying, has it become easier to make an appointment with Cone Health for a vaccine now that the FEMA site is up and running?
Yes, it has. The FEMA site has opened a lot of space. And if you're interested in getting the vaccine through Cone Health, it's conehealth.com/vaccine. We've got lots of sites open here in Burlington. And I believe there's lots of space available in the registry.
And it's one of those things where sometimes you can check it at 8 o'clock in the morning and all the spots are filled, but you go back at 2 o'clock in the afternoon and more spots have opened up.
Yeah.
So definitely, go on more than once a day so that you can see how things are going. All right, so this question is, can we hug our grown children who are not vaccinated? We, the parents, are fully vaccinated. We live in separate homes, and I would like to hug my grown children.
Well, if you read the CDC guidelines, you should be hugging your children.
Grown children, though. I guess we're talking about adults.
Right.
Mm-hmm.
Your adult children are not vaccinated, and you are vaccinated.
Yes.
Is that correct?
That is correct.
So if your adult children are in a low risk group and do not have significant exposures, the CDC would say that you should be hugging them.
Okay. This person says, if I had COVID and now have the antibodies, do I still need to get vaccinated?
Yes. So we are encouraging people to get vaccinated after they've had COVID. Those are the guidelines.
All right, and then this is a follow-up question. How long should I wait to get vaccinated after I've had COVID?
Yeah, the guidelines would say 90 days.
Mm-hmm. But if you are able to get your vaccination earlier than that because it's open, should you just take it or should you wait?
Probably wait.
Okay, and why is that?
Yeah, there's a little bit of evidence that says that people who've had COVID before will have a little bit of a stronger reaction to getting the vaccine. And so spacing that out diminishes that risk.
Okay. All right, we are going to take a very quick break, but we're continuing to take your text questions to the doctor. Remember, you can text them in 336-379-5775. We'll be right back.